Hi, and welcome to Prescription for Medication Education. My name is Yemi, and I'm a pharmacist, and I like to talk about all things medications related. With that being said, today's topic is going to be probiotics. Are they helpful? Are they harmful? Or are they just overhyped? Probiotics are live microorganisms that when we take them in large enough doses, they provide a health benefit to us. Some of the most common genus of probiotics include Lactobacillus, Bifidobacterium, Saccharomyces, and Bacillus, just to name a few. Probiotics work in various ways to exert their beneficial effect. One method is through direct competition with pathogenic microorganisms, which are the bad ones, for resources and physical space in our GI tract. Probiotics also produce antimicrobial compounds that can slow down the growth of bad bacteria, such as E. coli. Probiotics can improve our stomach's barrier function, which means they lower the amount of toxins that can pass through the stomach to the rest of our body. Probiotics can also stimulate and alter our immune response. This means that they can enhance our immunity and potentially even produce an anti-inflammatory effect. Probiotics are available in many forms such as capsules, tablets, powders, and foods. Natural sources of dietary probiotics include fermented foods such as yogurt, kombucha, and cheeses, just to name a few. I want to make it absolutely clear that probiotics are not regulated as medications in the United States. They are usually classified as a dietary supplement. What does this mean for you, the consumer? This means that they are not tested as thoroughly for safety or effectiveness as prescription medications and over-the-counter medications. This means some products can contain probiotic strains that do not match what the label states. They may contain bacteria that are no longer alive, or may even be contaminated. The probiotic industry has grown extremely fast, with sales expected to exceed $6 billion, and the number of American adults who use probiotics has quadrupled from 2007 to 2015. Many people use these products because of advertising or personal recommendations rather than strong medical advice. Probiotics are generally considered safe for patients who are immunocompetent, meaning they are considered healthy. Side effects of probiotics can include cramping, nausea, gas, and change in stool consistency. Although probiotics are considered generally safe, there are several patient populations who should either completely avoid probiotics or use them with caution. Examples of patients who should avoid probiotics include immunocompromised patients, for instance, someone with an organ transplant who is taking medications that weakens their immune system. Critically ill patients and hospitalized patients should avoid them as well. Premature babies and very low birth weight babies, patients with certain types of heart disease, patients with altered gastrointestinal systems, and patients with central venous catheters. Remember, these are general examples of patients who should avoid probiotics and not a complete list of health conditions. Probiotics may help prevent diarrhea caused by antibiotics, but they may not work for everyone. A large review in the Journal of the American Medical Association involving around 12,000 people found that taking a probiotic with an antibiotic lowered the relative risk for diarrhea by about 42%. In this case, this means that approximately 13 people would need to take a probiotic to prevent one additional case of antibiotic-associated diarrhea. As mentioned earlier, probiotics work through many different ways, and some strains have more evidence to support their use than other strains for specific health conditions. The American College of Gastroenterology, which is the medical association that is dedicated to the medical treatment of disorders of the gastrointestinal tract, supports the use of specific strains for the prevention of antibiotic-associated diarrhea. These include Lactobacillus rhamnosus and Saccharomyces boulardii. What about vaginal yeast infections, and what role do probiotics play? A vaginal yeast infection is an overgrowth of the fungus Candida, most commonly Candida albicans, which naturally lives in the vagina. When the vagina's natural balance is disturbed, which can occur due to antibiotic use, this fungus multiplies, which produces itching, swelling, and thick white discharge. Probiotics may provide some additional benefit when taken with an antifungal medication for an active yeast infection, but this is based off of limited research, and more research is needed before these benefits can be considered 100% certain. A review of 14 studies found that using probiotics together with antifungal medication may improve short-term treatment success and may lower the chance of another yeast infection within 6 months. Probiotics by themselves are considered inferior to antifungal medications for the treatment of an active yeast infection, meaning they do not work as well as an antifungal medication. which is why we do not recommend using probiotics by themselves for yeast infections. When it comes to the available evidence for the prevention of vaginal yeast infections, probiotics are not effective in preventing antibiotic-associated vaginal yeast infections. A well-designed study involving 278 women who were taking oral antibiotics for infections unrelated to the reproductive system were given lactobacillus as either an oral probiotic, vaginal probiotic, both, or placebo during antibiotic treatment and for 4 days after treatment. Basically, the study showed that the probiotics did not lower the risk for a yeast infection, and the study was actually stopped early because the researchers determined that continuing the study was unlikely to show a meaningful benefit. The main point here is that the current evidence does not support recommending probiotics to women taking antibiotics for the purpose of preventing a vaginal yeast infection. However, for women who have an active vaginal yeast infection, probiotics, especially lactobacillus containing formulations, can be useful when used along with antifungal medications to improve cure rates. What about the use of probiotics during pregnancy? I recently came across some information which surprised me regarding the use of probiotics and their use in pregnancy, which is why I decided to make this video. A recent 2026 systematic review and meta-analysis of 18 studies, including over 3,000 pregnant women, found no significant effect of probiotics on the resolution of vaginal yeast infections. The following information is what I found surprising. Studies have raised concerns that taking probiotics during pregnancy may increase the risk for preeclampsia, which is essentially high blood pressure and organ damage during pregnancy. One high-quality review found about 50 cases of preeclampsia per 1,000 women taking probiotics, compared with 27 per 1,000 women taking a placebo. A larger 2025 review also found a smaller but still significant increase in risk. The reason I want to highlight this information is because when you type in probiotics and pregnancy into Google, most of the information will tell you that they are generally considered safe during pregnancy. Data from multiple studies show probiotics appear to be well tolerated and have minimal adverse effects during pregnancy, but the Cochrane review from 2021 and the Umbrella meta-analysis from 2025 seems to indicate that probiotic use during pregnancy may not be completely safe. The reason probiotics might increase the risk for preeclampsia is currently unknown. I'll end this video with the following information. Bacterial-based probiotics such as lactobacillus can be harmed when taken with an antibiotic, so it's best to space them apart by at least 2 hours from the antibiotic to minimize the killing of the beneficial probiotic. Probiotics that are not bacteria-based, such as Saccharomyces boulardii, are not directly affected by antibiotics, which allows you to take them without regard to antibiotic dosing. It may be beneficial to take the probiotics for an additional 1 to 2 weeks after finishing your antibiotic to reduce diarrhea duration. Probiotics should be started as soon as possible after starting an antibiotic, but ideally within 48 hours. And that was your dose for medication education. I do hope you enjoyed today's video. If you did, go ahead and consider subscribing, leaving me a comment down below. It would mean a great deal to me. Thank you. Have a great day.